Labial hypertrophy or enlarged labia is really difficult to define because just like there's different body sizes and body types, there's different size labia. And so what might bother one woman wouldn't bother another. And so it's difficult to decide who should have surgery based just on a measurement. There are definitely patients who have very large labia. So we really base it on symptoms. And so although there are patients who want to have their labia reduced for cosmetic effects, what we look for are patients who are having symptoms. And so the symptoms usually, the most common are labia being caught in underwear, labia making it difficult to exercise, to run, or to walk, difficult or painful intercourse, and sometimes even causing or being related to excess urinary tract infections or vaginal infections because of their interference. And so those are the things that patients should pay attention to or see that would indicate that they might need to have that looked at. Labial hypertrophy occurs in probably about 1% of patients, but it could be as high as 10% depending on symptoms. Extra large labia is much less common, but labia that affect women and change their lifestyle is more common, and so it could be up to 10% of women. And that's really going to be patient specific. And again, like I said, we're happy to do an exam and take measurements, but honestly, your story is more important even than the exam and the measurements, because how you feel about your labia and the effects you've had will tell us more of whether you need surgery versus something else.